Friends, till now we have spoken about TMDs in our extensive video series, right? So in the last video we have spoken about the definition and the theories related to the etiology of the TMDs. Now in this video we will be talking about the symptoms of the temporomandibular disorders. So let's begin. The disorders are multifactorial. They could occur because of a trauma or because of sleep disturbances, emotional stress, okay, changes in the masticatory system or parafunctional habits, etc. Identifying the correct cause will help us in giving the correct treatment to the patient to relieve the TMDs. Understood? So what happens is when the functional changes begins, okay, it starts to exceed a critical level. At the critical level, when the functional changes starts to exceed, there is an alteration in tissue that begin, and that is a level known as structural tolerance. Okay, now when the structural tolerance exceeds, that beyond this we cannot change, okay, the body cannot change, what happens is breakdown occurs, and the initial breakdown is at the lowest structural tolerance. Now coming into the considerations of TMD, it could be because of the trauma, it could be an initiating factor like for direct fall on the chin, okay, mandibular fractures, or it could be due to the other factors, okay, like parafunctional habits, etc. Now this could not only hinder with healing but also increases the risk of TMDs and orofacial pain. Alright, now let's understand the etiologic factors in detail. The first is the predisposing factors. Now this could be systemic factors like osteoarthritis. Okay, now this arthritis, what it causes is it causes thinning of the condyle, okay, which will again result in the structural changes. Or it could be a psychological factor that there is lot of emotional stress, okay, sometimes the muscle goes into spasm because of that. Or it could be sleep disturbances, okay, which is causing again the muscle spasms. Or structural factors like malocclusion is there, or it could be genetic. All right, now coming to the initiating factors or the factors that result in or that episode of that factor causes onset of TMDs. Now these initiating factors could be a trauma, as I told you earlier. It could be a micro trauma or a macro trauma. We'll be talking about this in detail, but micro trauma is basically what happens again and again, that like parafunctional habits. Macro trauma is something like a fall, okay, or a road traffic accident. All those things are trauma, okay. Now overloading of joint structure begins because of parafunction habits like night grinding, all right, and then there is a obviously mechanical and muscular stress that occurs, okay. Also metabolic problems also play major role, all right, like in GERD, if you have frequent vomiting, it will again result in the muscle spasms, etc. Coming to the occlusal conditions, okay, or what we call as malocclusions. Earlier, malocclusion was considered as a major causative factor, okay, but then the Pullinger et al. Study stated that the malocclusion is, it can be one factor, but it is not the only main factor that is causing TMDs, okay. And other than that, many of the patients who have TMD has this four major occlusal features, okay, or it could be one of them, that is presence of skeletal anterior open bite, then missing teeth, 5 or more missing unreplaced posterior teeth, okay, then overjet of greater than 4 millimeter, and last retruded contact position and intercuspal position slides of greater than 2 mm. Now let's talk about the effects of occlusal factors on orthopedic stability. Alright, so the first factor is whether an intracapsular disorder will develop and or not. Okay, now there are two factors that determine whether intracapsular disorder will develop or not. First is the degree of orthopedic instability, that is if the discrepancy is of 1 to 2 millimeters, okay. Then second is the amount of loading which occurs on the muscular system as well as the occlusion. Okay, so patients having bruxism will have more amount of occlusal loading. Okay, other than that, the effects of acute changes in occlusal conditions and TMD is also determined. So first is activity of masticatory system. Now this can be divided into two basic types. First is functional, like chewing, speaking, swallowing, okay, which we do normally. The other is a parafunctional habits. Okay, now this can also lead to TMDs like clenching or grinding of teeth. Okay, other than that, the functional muscle activities are controlled. They are protective reflexes which are constantly present, right? Which guard against potential damaging contacts and directly influence the occlusal conditions. Understood? Others are parafunctional activities. Now these are they have totally different controlling mechanism. Okay, instead of being inhibited by tooth contact, earlier concepts suggest that the parafunctional activities are actually provoked by certain tooth contacts. Okay, but this theory, this concept was basically, most of it was disapproved. Understand the occlusal interferences which affect muscle systems. Alright, and how does it affect? So we all know that when chewing or speaking, these are controlled activities, right? That is, the movement of these muscles are controlled, as well as there is a defense mechanism which prevents potential damage, right? Now what happens if there is any acute changes? Alright, that will cause protective co-contraction of these muscles. Alright, and as the occlusal interferences become chronic, the muscle response is also altered in two ways. That is, first is the muscle engram has to avoid potentially damaging contact. Okay, that is, they go into contraction. Alright, and the tooth movement also starts accommodating heavy loading. So if there a patient comes to you, okay, he has undergone some dental treatment. Okay, so filling has a high point, or your cap is not fitted properly. Alright, they may have a high point. Now this will also, it's a small thing, right, but it will cause a major change because it will cause protective co-contraction in the muscles, okay, which will result in altering the movements of the muscles to prevent potential damage, and also will cause tooth movement to accommodate for a heavy loading. Okay, so this is one of the examples of the occlusal interference. Now let's learn about the other factors of the TMD. Okay, so we'll talk about trauma now. So trauma basically is it could be an initiating factor also. Okay, so this is a factor which can cause onset of the TMD. Trauma are micro trauma and macro trauma. Alright, now let's talk about macro trauma in detail. So the first thing is, these traumas could be direct. That is, they cause direct blow or instantly impact the TM joint as well as mandible. Okay, that is like a blow to the chin can directly cause intracapsular disorder. Okay, or open mouth trauma can cause discal displacement or dislocation. Okay, other than that, iatrogenic trauma like third molar extractions can directly affect TM joint. Alright, or intubation procedures of general anesthesia also can directly affect TM joint. Alright, now indirect traumas are the ones which do not come in direct contact with the mandible, okay, or TM joint. So this occurs secondary. Now this most common is cervical flexor extension injuries, that is whiplash injuries, which occurs in the road traffic accidents. Okay. So the micro trauma, basically they are the small forces that are repeatedly applied on the joint structures for a long period of time. Alright, so what happens, like there are parafunctional habits like clenching or bruxism, they increase the occlusal load. Okay, so when the occlusal load increases more than the functional limit of this tissue, the collagen fibrils become fragmented. Okay, now because these collagen fibrils have become fragmented, there is decrease in the stiffness of the collagen network. which allows the proteoglycan water gel to swell and flow into the joint space. So what happens when they flow into the joint space? They basically soften the articular surfaces. Okay, and that is nothing but your chondromalacia. So what is chondromalacia? It's softening of the articular surfaces. So in the early stages of chondromalacia, if these excessive loads are removed or reduced, it is the process becomes reversible. Okay, but if it keeps exceeding, then the irreversible changes occurs. Got it? And this is mainly caused by clenching, bruxism, which causes posterior border thinning of the disc. Okay, also causes elongation of inferior retrodiscal ligaments. All right, and this also leads to disc displacement. Let's understand about the emotional stress. Basically, what stress does is it activates the hypothalamus, correct? Because of which the body responds by autonomic system, which increases activity of gamma efferents. Okay, and the intrafusal fibers of muscle spindles begin to contract. So the muscle basically has muscle spindles, right, which starts to contract. So what happens, even a slight stretching of these muscles will result in reflex contractures. Okay, and it will also result in pain. If you try to open your mouth and the muscle is contracted, you'll feel pain in the muscle. Okay, so it overall increases tonicity of these muscles. Coming to the deep pain input, they can centrally excite the brainstem, producing protective co-contractures. Alright, mainly occurring in parafunctional habits. Other than that, for example, a patient may come with limited mouth opening because of toothache, and he may complain that he is not able to open the mouth because of toothache or because of pain. Okay, but mainly deep pain inputs are seen from parafunctional activities. Okay, it could be because of clenching, bruxism, thumb sucking or finger sucking, or because of your cheek or tongue biting. Okay, now parafunctional activities could occur throughout the day, which is known as diurnal, or it could occur throughout the night, that is nocturnal. Now in the nocturnal habits or activities, it could be because of it could cause single episode, that is clenching, or it could have rhythmic contractions like bruxism. Now, bruxism basically is non-functional grinding of the teeth, and it is mainly associated with change from deeper to lighter sleeps. Okay, closely associated with arousal phases of sleep, and during 1 hour of your sleep, total bruxism time is 40 seconds per hour. Okay, and average bruxism event lasts for 9 seconds. Understood? So, this is it. We have spoken about deep pain input, emotional stress, trauma, occlusal instability, which causes the symptoms and which are the main symptoms that cause the TMDs. All right. So, to conclude, to manage TMDs effectively, a clinician must be able to determine the etiology. Only once when you remove the etiology, TMDs can be cured. Okay, and since TMDs are multifactorial, depend on complex and variety of factors, you have to understand the interplay between these factors. Okay, and understand one thing, occlusal is not the sole factor responsible for your TMDs. Okay, thank you. Please share and subscribe.